researchers who had worked on IPREX attended this forum. And at this forum, they shared that in the analysis, since IPREX was originally published, they were able to learn a lot more about how well Truvada worked. And although their initial findings said it worked in 44% in terms of reducing risk, that was looking at everybody who was given Truvada, not everybody who took Truvada. I want to make sure you all understand the difference. There's a really big difference when you give a group of people Truvada, because then you average in all the people who took it 0 days a week and all the people who took it 7 days a week. And when you average in those numbers, that's where they got that 44% from. When they just looked at the numbers of people who actually took the drug 4 days or more, there were 0 infections. 0. Not one person who took the drug 4 days or more in the IPREX trial became HIV positive while in the study. Meanwhile, people who did not take it, or people who took it 3 days or less, did become positive. Whoa. Right? That, for me, was delightful. Now, maybe this Truvada thing is for me. But let me think, could I remember to take a pill every day? Let me think. I wake up every day. I have cereal every day. I drink coffee every day. I'm on Facebook every day. So I think somewhere in that routine, I can integrate a blue pill somewhere in there. I went to my doctor, and I was really, really scared to talk to my doctor about this. Because A, I didn't know if he knew anything about IPREX, and B, I had a doctor in New York City, but we had never talked about something personal like sex before. Why would I talk about sex with a doctor? I say that now, and it sounds funny, but back then it was like, I was a relatively healthy HIV negative person, and the only reason I ever saw a doctor was because my sinuses hurt or I couldn't sleep, which happened a lot. So we had never talked about sex before. So going to an authority figure for the first time, pretty much to admit I'm having condomless anal sex and I don't want to get HIV was a pretty scary thing. But I went to him and I said to him, if I was a woman and I came to you asking for birth control pills, would you approve of me using birth control pills? And he said, sure. And I said, and what if we had a vaccine for HIV? What if someday we did have a vaccine? Wouldn't you approve of me using a vaccine to stay HIV negative? And he said, yes, of course I would. And I said, okay, well, I'm not going to become a woman, and I don't know if we're ever going to have a vaccine. But at least if we have a vaccine, until we have a vaccine or a cure, I want to use PrEP to stay HIV negative. And fortunately, I had a doctor whose attitude was pretty much like, okay, David, you know what, you're an adult. This is what you feel is right. I will support you. He wrote a prescription, I got it filled, and July 19th, 2011, I started using PrEP and have been using it consistently ever since. 5.5 years now, ever since. And when I say that, people often ask me, so like, well, what were the side effects, right? Well, what did you feel? And I say, there were some side effects that took me by surprise, but it's not what you're thinking. The biggest side effect I had was a lifting of fear, was the ability to have sex with partners and not be afraid that I was going to get HIV. And I was one of those people who grew up in the time in the 80s when Rock Hudson was on TV being exploited by the media. So I always, right, remember? Like, they treated him horribly, right? And I always thought, that's gonna be you someday. That's gonna be you someday. And I woke up in the middle of the night, frequently, with night sweats, with swollen lips, thinking, this is it, I'm becoming HIV positive. All of that went away when I started using PrEP. All of that fear that I've been carrying around for 22 years without even knowing I had it started going away and started lifting. And I'm like, this is amazing! Why isn't everybody using this pill? And I thought, well, maybe one of the reasons why nobody's using this pill is because the FDA hasn't approved it. And I'm kind of using it on the down low. You know, my doctor's prescribing it, but I'm afraid my insurance company is going to stop paying for it, so I'm afraid to talk about this with anybody because I don't want to get busted. Well, then July 16, 2012, what happened? FDA approved it! So, July 16, 2012, the Food and Drug Administration approved Truvada as the very first HIV prevention strategy in this country. And yes, you heard that correctly. Truvada is the first, and so far only HIV prevention strategy that has ever been endorsed by the FDA. Condoms have never been endorsed by the FDA as an HIV prevention strategy. Okay? Just saying. So I thought this was going to be cause for major celebration. I thought this was going to be like, hurrah! I thought this was going to be like the kind of thing that people were going to storm the streets to celebrate. I thought they were going to go to the Stonewall Bar and run it, and they could have done it because it was a summer night. It was really hot, and people could have done it. And I thought people were going to be happy, and I thought they were going to come together and laugh and cry and hug and say, thank God we did it. We made it through the worst plague of our lifetime. And after seeing so many people we love get sick and suffer and die, we're here for the beginning of the end. But what happened instead? Thank you. Nothing. Very well put. Zero. Nothing. There was no celebration. There was hardly an acknowledgement. The media didn't cover it. And in New York State, the Department of Health, our agencies, organizations, our doctors, prescribers wouldn't touch it with a 10-foot pole. And now I'm like, what the F is going on? How is it that we now have a way to end HIV, reduce infections by at least 99%, and nobody's talking about this? So I started talking about it. When I was doing the vaccine research, I started talking to some of the club owners and started talking to some of the drag queens. And I started just having more conversations with this with people one-on-one, not in a big space like this, but just one-on-one. Because again, my job was to talk about condoms and vaccines, not PrEP. And I didn't want to get in trouble. So I was having one-on-one conversations about it, and it eventually led to an opportunity to go on the Huffington Post Live to do a 30-minute talk about PrEP. Now, that was when the Huffington Post Live was something that people watched. I mean, it was a regular thing. It was kind of a big deal. I got to go to their studio in Lower Manhattan and sit with Alicia Melendez, who is really, really wonderful. And we just talked, and actually there was a lawyer from an agency that opposes PrEP that was on the telescreen, and we had a little debate. So that was fun. And I thought, okay, this is great. Now, this is November 8th, 2012, and I thought, finally, people are going to learn about this, people online are going to hear about this, people are going to finally start to learn about PrEP and be really glad about this, because this is the beginning of the end. And then what happened instead? This time something happened.
Truvada whore.
Yay, gold star. This time, the backlash started. So once people started learning about it, they started reacting to it very, very negatively. There was a writer with the Huffington Post who wrote an article 3 days later, infamously titled Truvada whore. And it's online and you can see it. And unfortunately, that is how many people heard about PrEP for the very first time. It was in this framework of something very pejorative and negative and like, there's something pathologically wrong with you if you enjoy sex without condoms. And this was directed at me or anyone who is using Truvada for PrEP to try to stigmatize us and shame us for using a pill to stay HIV negative. And that is what, as they say, went viral online. That is what came up in the forums. That was the information that was online at the time. If you talked about PrEP, you somewhere you would see Truvada whore because there wasn't any other information out there. And I'm beginning to be like, how could this be? What's going on? How could this, again, we have this way to end HIV and people are upset about it? How could this be? So then April 25th, 2013, another major date. Now I don't expect anyone to know this. Aside from it being my birthday, anybody know what happened on that day historically? What's that? Partners? Not yet. That's coming. But close. This was related to the vaccine trial I had been working on for 4 years. It was announced on April 25th, 2013 by the Data